now to the latest coming in, this shocking tragedy from the African nation of Gambia, where 66 young children have died, allegedly because of 4 Indian-made cough syrups. The Gambia has said that these are linked to a dangerous chemical which was found in these cough syrups. The World Health Organization has also issued an alert. For more, let's go across to Priyanshi. Priyanshi, what's the latest we know about this tragedy of 66 deaths amongst Gambian children?
Right, Sonia, we know that Gambia has announced recalling these drugs. They're conducting a door-to-door campaign to make sure that these are not being used in any household. So that's happening in Gambia. Meanwhile, the Indian government has also issued a response to this. The Indian government has said that these drugs may have been contaminated with glycol or ethylene glycol. We spoke to doctors about this, and doctors said that these chemicals are not used in medicines at all. They've never been used in medicines. They are industrial chemicals. In fact, this is a solvent that's used in antifreeze and brake fluids and dyes, etc. So that is why the doctors we were speaking to, they were telling us that it is a high probability that these entered these drugs through contaminated water. So it was not a salt defect. The salts being used in these cough syrups are something that are used in others as well. But the defect was in manufacturing. It wasn't clean manufacturing. Now, the government has said that the exact one-to-one causal relationship of the death is not yet provided by the World Health Organization. The government has raised certain questions to WHO that is there any specific link saying that the 66 deaths are directly and exclusively linked to the cough syrups. That's something that the WHO has not replied on yet. Now, another question that's important for all of us, and what is a concern for all of us, is that were these drugs available in India? Well, the official responses that we have till now, and even the pharmaceuticals and drugs that and doctors that we checked with, all point to the same thing, that they've been only sold in Gambia, they've only been exported, and they've not been sold in India. In fact, if we also talk about the license, the drug controller of Haryana had given them the license to produce, only to import to other countries and not to sell in our country. But this also raises a question: if there were manufacturing standards that were not being met at this company, at Maiden Pharmaceuticals, why was it given the nod by the Haryana drug controller? So the manufacturer is
questions then, as with the WHO, as you said, Priyanshi, really raising that red alert. Remember that, of course, Indian pharmaceuticals are exported globally across the world. So really, really tragic that it's being linked now to these deaths of young children. Let's just hear what the WHO Director General said.
WHO has today issued a medical product alert for 4 contaminated medicines identified in the Gambia that have been potentially linked with acute kidney injuries and 66 deaths among children. The 4 medicines are cough and cold syrups produced by Maiden Pharmaceuticals Limited in India. The loss of these young lives is beyond heartbreaking for their families. WHO is conducting further investigation with the company and regulatory authorities in India.